Potassium permanganate irrigation. Janet's method. Janet devised the permanganate irrigation treatment for acute urethral gonorrhea. He introduced neither the drug nor the method, but he combined the two in a practical system. His instruments are sold in this country under the name of Valentine, and his method is often incorrectly spoken of as Valentine's method. Janet irrigates the posterior urethra by gravity without a catheter. He irrigates the anterior urethra twice a day for 3 or 4 days, then increases the interval from 12 to 18 hours. When the cloudiness of the first urine is pretty well gone, he makes the interval 24 hours. When the discharge is no longer purulent, he makes it 48 hours. When the second urine becomes cloudy, he irrigates the posterior urethra according to the same method, twice a day at first, later every day or every other day. For each irrigation of anterior or posterior urethra, he employs 500 cc's of fluid at a temperature of 110 degrees Fahrenheit. If the case is seen before the appearance of marked inflammatory symptoms, he employs a 1 to 500 solution of permanganate, immediately followed by a like quantity of boric acid solution. If this does not prove too irritating, he continues at this strength until the inflammation has subsided sufficiently to permit intervals of 36 to 48 hours, when he drops to 1 to 4,000 or 1 to 6,000 permanganate and omits the boric acid. If the posterior urethra becomes inflamed, he begins irrigating it with solutions of 1 to 4,000 down to 1 to 10,000. If these are well borne, he increases the strength to 1 to 2,000 or 1 to 1,000 and follows it with the boric acid irrigation. If the patient is first seen after the appearance of acute inflammatory symptoms, the irrigation is begun at 1 to 10,000 to 1 to 4,000 strength, and only for the anterior, even if the posterior urethra is inflamed. He begins treatment of the posterior urethra only when the anterior inflammation is under control. In the declining stage, he gives a daily irrigation of 1 to 6,000 to 1 to 8,000. Other methods. Valentine and the other followers of the Janet method in this country follow his method with certain variations. They usually employ much weaker solutions, 1 to 4,000 to 1 to 20,000, and larger quantities, 1,000 cc's or more, and often irrigate the posterior urethra every day or every alternate day as a routine measure. Results. Janet claims a cure within 3 weeks for most cases seen early, and Valentine says no other method can show 90% of cures in 14 days. Yet, the method which was almost universally tried 10 years ago has now quite fallen into disrepute. I can add one more voice to those assembled in protest by Horwitz. I cannot even say that I have found it useful in conjunction with the silver salts until the acute inflammation has been controlled. But in the terminal treatment, it is a most valuable remedy.